Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone. Welcome to today's professional. Today we're talking about Lima Dental Associates, and with us to talk about herbal supplements and their effects on the mouth. And some of this is, boy, I never heard about this. Dr. Wesley Shankland.
Hi, George. How are you today?
I'm doing terrific, Doctor. Thank you.
Herbal supplements, it's interesting. You know, all medications and drugs come from somewhere. And the former ones, the old ones, for example, aspirin came from willow bark. So all of these had their originations early in plants and in trees and things like that. So a lot of people today, over 20% of Americans take herbs and supplements. And more than a half of the people do not tell their doctor when they interview them for a health history. And the problem is this, George. Many of these supplements, no matter how efficacious they are, a lot of them really work well, many cause bleeding.
I was going to say, what effects do they have?
Well, they cause bleeding. And now if we do any kind of surgery, we have a problem. It's like taking Coumadin. If we don't know about this, they bleed excessively. They take a lot of vitamin C. Vitamin C helps knock out the effect of local anesthesia. So you don't want to take vitamin C a few days before you go to your dentist. You want to stop ginkgo biloba, L-arginine, ginger. You want to stop garlic, all those kind of things that can affect bleeding in people. So it's important, not just the mouth, but systemically. But you need to talk with your physician, your dentist, when you give your health history. See, a lot of people don't do that because they're not prescription medications. They think they're not important.
They can just buy them and it doesn't matter.
That's right. Well, just like if you take a lot of aspirin, you take a lot of aspirin, you have some oral surgery, you're going to bleed a lot. Right. So we need to know that ahead of time so we can plan for that. And the herbs and supplements are the same way too. So when you see your physician, you see your dentist, if they don't ask you, you should offer the information about what kind of herbs and supplements you take.
That's important. You have to let them know that what you're going through.
Well, not only that, for systemic problems and oral problems, but also interactions with drugs we prescribe. So it's important for us to know, and your physician to know, or any kind of healthcare professional to know exactly what you're taking. Even if it's not prescription, we should know about that, because that affects how we treat you, how we plan to treat you, and how you could recover. So it's important for us to look at that and know about that in your health history.
You have something coming up very shortly here.
We got something coming up, that's right, August the 14th at the library. We're going to have an informational free seminar from 6 to 7:30 on obstructive sleep apnea. We're going to talk about the effects of sleep apnea on August the 14th, Thursday night, from 6 to 7:30.
And
keep smiling, sharing, and caring.
Thank you, Wes.